Have you ever considered what happens when your body sends a sudden, urgent signal that something is critically wrong, especially when it affects your movement? It is a moment when every second truly counts, and understanding these signals can make all the difference. Yes, sudden paralysis or profound weakness, particularly when it affects one side of your body, is a very serious and classic symptom of a stroke. If you or someone you are with experiences this, it is absolutely essential to call emergency services immediately. This is not a situation to wait and see if it improves. The reason for this sudden paralysis is directly related to how a stroke impacts the brain. A stroke occurs when the blood supply to part of your brain is interrupted, either because of a blocked blood vessel, which is an ischemic stroke, or because a blood vessel ruptures and bleeds into the brain, known as a hemorrhagic stroke. When brain cells are deprived of oxygen and vital nutrients, they begin to die very quickly. Since different parts of your brain control specific body functions, including movement, damage to these areas can lead to sudden weakness or complete paralysis. Often, this affects one side of the body because one hemisphere of the brain controls the opposite side of the body. Knowing what to do is crucial. The best way to recognize a stroke is to remember the acronym F.A.S.T. The F stands for face drooping, meaning one side of the face might look uneven when smiling. The A is forearm weakness, where one arm drifts downward if asked to raise both arms. The S is for speech difficulty, such as slurred words or trouble understanding speech. And most importantly, the T stands for time to call emergency services. Noting the exact time the symptoms started can also provide critical information to medical professionals. It is also important to understand that sometimes these symptoms, like sudden weakness, might temporarily improve or even disappear. This could be a transient ischemic attack, or TIA, often called a mini-stroke. Even if the symptoms resolve, a TIA is a serious warning sign that a full stroke could be imminent, and it still requires immediate medical attention and evaluation. Acting quickly on any stroke symptom, whether it is transient or persistent, can help doctors preserve brain tissue and significantly improve recovery outcomes. Ultimately, recognizing sudden paralysis or weakness as a potential stroke symptom is a powerful piece of knowledge. Your swift action, whether for yourself or a loved one, can profoundly influence the course of treatment and the potential for recovery. Be aware, be informed, and be ready to act fast.